My name's Francesca Hanna. I'm at the Peter Moore Library today because I'm publicising ovarian cancer symptoms, because this month is Ovarian Cancer Awareness Month, and unfortunately I was diagnosed with it nearly 8 years ago, and because I was diagnosed quite late, it was already stage 3. Mine has recurred a number of times, and in fact I've been very lucky to get this far and to be fairly healthy between treatments. But if you get diagnosed early at stage 1, you've got a very good chance of survival and actually being cancer-free. It's important to be aware of your body and to notice different symptoms. The symptoms that are most likely to happen with ovarian cancer are that your abdomen and your stomach is going to swell. It's going to feel a lot bigger. You're going to feel bloated. It might mean that your bowel habits change, that you also might need to go to the toilet more often, and this will be quite persistent. It won't just be occasionally, it'll happen quite regularly, and it won't go away. It will usually get worse, and you may have pain in your abdomen and your stomach. It may mean that there are changes too in your periods, if you're still having periods. Unfortunately, ovarian cancer symptoms often appear to be the same as irritable bowel syndrome and also early onset menopause. So it's very easy to ignore them or to minimise them. And unfortunately, as women, we often have a bit of discomfort, a bit of pain, especially around period time. And we might think we better not bother the doctor, but it is really important to bother the doctor. I wish I'd bothered the doctor more. And actually, to get diagnosed is relatively easy. If you are having these kind of symptoms, it's a good idea to keep a diary for a month or two, and then go to your doctor. And be quite persistent. If they send you away with some tablets for irritable bowel syndrome, be persistent. Ask. You can have a blood test, which is a very simple blood test called a CA125, and that will show up a protein that is associated with ovarian cancer. And if that's elevated, then they should then also send you for an ultrasound scan, which again is very simple, easy to do, and that will generally, those two tests will generally show if you've got the beginnings of ovarian cancer. And if it's caught at stage 1, you have got an extremely good chance of survival. Once it's spread, then the survival rates do go down considerably. So my advice is really do go and bother the doctor. Even if it is IBS, it doesn't matter.
Right.
But it's worth it.
Okay. Is there anywhere online that people can go to for more information?
There are a number of ovarian cancer charities, and one that's got a lot of useful information and that has quizzes and talks about the symptoms, and is called Target Ovarian Cancer, which if you look that up online, you'll find the website. It's a very easy to use website.
Okay.
And they also have people you can talk to on the phone line.